Anilingus is a sexual act that involves oral to anal contact. This could be licking, sucking, or kissing the anal orifice. It is also called rimming, or rim jobs, or salad tossing, or eating ass. Now, due to the fact that it involves the mouth and the anus, this opens up the route of fecal-oral transmission of diseases. When a rim job is performed on one who is infected or a carrier of a fecal-oral infection, there is a chance of getting that infection. So there is a risk of contracting a fecal-oral disease when practicing unprotected anilingus. So if rimming is one of your sexual pleasures, there are some vaccines that might be important to you. Hepatitis A is a deadly viral liver disease characterized by fever, body pains, diarrhea, vomiting, yellowness of the eyes, darkening of the urine, and many other symptoms. The mode of transmission of hepatitis A is via fecal-oral route, meaning if you administer lingual pleasure to the anal orifice of a hepatitis A carrier, you are likely to be infected by it. There have been instances where hepatitis A was transmitted due to anilingus or rim jobs. There was an outbreak of hepatitis A in Krakow, Poland from February 2017 to February 2018. The university hospital reported 119 cases of hepatitis A virus. In 84 patients, that's 71% of them, the virus was transmitted via oral to anal sexual contact. Another interesting fact, only one patient of all the patients was vaccinated against hepatitis A before the symptoms appeared. The patient was vaccinated by only one dose after exposure to close contact with hepatitis A infection. Hepatitis A vaccine is a 2-dose vaccine, so he didn't have full protection. The Hep A vaccine is 95% effective in preventing Hep A after completing the 2 doses, so get your vaccine. Typhoid vaccine. Typhoid fever is a life-threatening infection caused by the bacteria Salmonella typhi. It is usually spread through contaminated food or water. I'll share more about typhoid in upcoming videos, but know that typhoid can be transmitted via anilingus. There was a case reported in Oxford Academic Journal in Ohio, USA in 2000, where 6 men were confirmed positive for typhoid and 2 were suspected cases after coming in contact with a typhoid positive but asymptomatic male who recently returned from Puerto Rico. Among these 8 men, it was reported that 5 of them engaged in oral to anal sex with the first man, and 1 licked the hand he used to arouse him. So yes, typhoid can be transmitted by a rim job. So you should consider getting your typhoid vaccine. HPV, Human Papillomavirus. Human papillomavirus, being the most common viral infection of the reproductive tract, can also be transmitted via anilingus. HPV is a cause of some anal cancers. If you engage in anilingus, ensure you get your HPV vaccination. There is more info on HPV in other episodes. Hepatitis B is a contagious viral infection that, despite not being a fecal-oral disease, can be transmitted in that route, particularly in the presence of any bleed or open wound in the oral orifice. More on the Hepatitis B vaccine can be found in the Vaccines to Protect You from STIs episode. These are all infectious diseases that could lead to devastating complications. By taking your vaccine, you're not only protecting yourself, but you're protecting those around you. Finally, these vaccines are not a pardon to engage in risky health behaviors. Ensure to use a dental dam during any form of oral sex. A dental dam is a barrier that prevents the spread of STIs during oral sex. There are other diseases with fecal-oral transmission routes that further research might be needed on the possibility of also being linked to anilingus. For example, polio. New cases have been resurging in developed countries like the USA. The virus has been discovered in sewages in the United Kingdom. Then the cholera outbreaks in Syria, Nigeria, Pakistan. Anyone infected with these organisms is at risk to another person, especially if unvaccinated, if they practice oral to anal sexual pleasures. That goes without saying. If you engage in any sexual activity that involves anyone defecating in your mouth, the risk of these diseases and many more is way, way higher. So if you like your tongue connected to the rim, ensure you're protected to the brim. If you want to learn more on vaccines and understand why you need them, please subscribe to my page, Med with Cred, and turn on your notifications to alert you for the next video drop. Please like, share this video, and leave comments and ask questions. Thanks for watching. I am Dr. Adedotun Ayodele, and this is Vaccine Doc. Goodbye. See, I'm the Vaccine Doc, a dedicated show to tell you what the vaccine does. I'll tell you of all the outbreaks that vaccines stop. Vaccines save lives, and we can back this up.